When Texas is stretched thin with its COVID-19 response, Governor Greg Abbott can ask the federal military to help. He first made that call in July to help doctors and nurses in the Rio Grande Valley. And he asked again this month for servicemen and women to go to El Paso. Erica Proffer spoke with those on the front line.
We have increased by 5,710 positive COVID-19 cases and unfortunately increased by 135 deaths.
Everybody now knows somebody who's lost a loved one.
We were at 206 deaths last week. We are now sadly reporting 341.
We have the potential still for a lot more suffering.
Our death case is at 407 right now.
These people are taking a long time to get better, and a lot of them may not.
We extend our most sincere condolences to the families who fight against COVID-19.
This great state of Texas said, hey, we need help here. And a lot of us said, well, yeah, let's go help out our fellow citizens down in Texas.
This is inside Harlingen Medical Center along the Texas-Mexico border. Video provided by the Department of Defense. In July, Texas Governor Greg Abbott called in the military to help hospitals in the Rio Grande Valley. The death toll was rising fast. July 1st, Cameron County averaged 6 deaths a day. 3 weeks later, it was 20 a day.
But this has been a very long ordeal for our staff.
I was here when we had H1N1s, and it's nothing like this. You didn't see the death toll. You did not see how sick everyone has become. And no pandemic like this, no flu or anything has been like this in this devastating.
The Rio Grande Valley isn't equipped to handle hundreds of people needing intensive care. 10 hospitals cover the 4 counties.
We know that part of the challenge that you deal with in the Rio Grande Valley is the challenge with health care. When a community is unable to provide the hospital capacity for people in the community who may become ill, that means that additional action needs to be taken.
I'm Major Lynn Del Rosario. I've been in the Army Reserves for 26 years now. Started enlisted and then just worked my way, got commissioned. Went from medic to RN to nurse practitioner. Now work for pulmonary critical care in Jacksonville, Florida.
My name is Sergeant Major Glenn Del Rosario. I'm in the Army Reserve now for 29 years. By default, the officers, outranked, they enlisted. So I'll give my sister that.
The major and sergeant major are brother and sister, each left behind family in Jacksonville, Florida to come here, not knowing how long they'll stay.
I'm married and I have a total of 4 children. I think some of the hardest things, missing birthdays already. So
I have 2 girls at home. They're 11. About to be 12 in about 2 weeks. I'm just gonna do the whole FaceTime, send her a big surprise in the mail, and then we'll make up for it when I get back.
Glenn Del Rosario is a registered respiratory therapist. Before this mission, he was in Iraq.
How does it compare being here on this mission versus your duties abroad?
That this hits home because we're taking care of our own fellow Americans. When we're in theater overseas, we're servicing soldiers and service members and other allied service members that are in combat. But here, it does hit home because the environment maybe is not dealing with the enemy, but the enemy here is COVID.
This is one of 2 hospitals where the Department of Defense is stationed in Cameron County. The other one's about a mile away, and both of them are at their max.
We have a phenomenal, and I call them our core group of staff, but that core group of nurses, they stretched, and that's the best way I can say, some uncomfortably.
Stephen Hill is the chief nursing officer at Valley Baptist Medical Center in Harlingen.
So you can be stretched by numbers, or you can be stretched by the severity of the illness. And the complexity of not having family here with visitation, all the above, the phone calls.
More than 100 military men and women are here.
It's busier, but the best thing is, just protecting yourself and just doing your day-to-day patient care. It is hard on the mental health.
Harlingen is in Cameron County, a place where undercounted census numbers limit government funding, says a Cameron County judge.
The 4 hospital CEOs got together when we knew that this Army team was coming in, and we basically just had a very frank conversation about what each one of our needs were. Typically we're competitors, right? But now we're all in this together. And
Have you ever had the military come in? I mean, if you've been here 20 years.
No, never have.
Never had this.
This is the first time.
What would it have been like if the military folks hadn't been here?
The word would have been catastrophic. Not about ratios, it's about that acuity. It would have been a very, very different picture than what you're seeing now, and not for the better.
What's unique about our profession as being both military and working civilian is we have that mix of our profession in the civilian sector where we came from, and then how the military standards of Army medicine is.
What is it that you want the people to know even outside the Rio Grande Valley?
I really don't know that the true population realizes when you do have this surge, you do have this spike, it's bad. I don't know how you can communicate that so that people understand that it's serious. When you do have these spikes, you do have these surges, when hospitals meet capacity, it's a big challenge. It's a challenge on the resources, but it really is a challenge on patient care.
Until you see it, it's so real, and the survivability rate once you're on some of these machines is so low. We just hope that our presence really makes a major impact, a dent where they can feel some relief.